welcome to the 9th edition of Ask the Experts. Now, this platform is a platform that was designed to give opportunities to journalists to engage experts in different fields to get to the bottom of current affairs issues. And it's made possible by the Namibia Media Trust and obviously the DW Academy. Now, before we get into this morning's discussion, the NMT team took to the streets to speak to the average Namibian to gauge their views on really what they thought about the vaccine and taking the vaccine as well. Let's take a look at this video.
I personally wouldn't take the COVID-19 vaccine because I believe that, and I feel like there's a lot of inconsistency when it comes to these different vaccines, and there's also no sufficient information to make me or convince me to take this particular vaccine, so no.
Okay, no, I won't take the COVID-19 vaccine because I believe there are hidden motives behind the vaccine. Bill Gates, the person who is financing the vaccines, said in one of his interviews that he wants to reduce the world population by 30%. Also, if you notice, the vaccines that they are distributing in the US and the ones that they are distributing in Europe are also not the same vaccines that they are distributing in Africa. So I feel like there is a hidden motive to, I don't want to say kill the Africans, but definitely to weaken our immune systems.
As a junior counselor, I have two answers to that question. Yes, because if I don't take it, I might get COVID-19 and spread it, which will even increase the regulations, which are truly annoying, to be honest. And no, also because I do not know what's in the vaccine. They did not give us a description of exactly what is inside the vaccine, and the person that made the vaccine did not take the vaccine.
No, Auntie is not going to take a COVID-19 vaccine. Yeah, because I hear that like the first time they were saying all of us we are going to take COVID-19, but now they are telling us that only COVID-19 is only for people from 18 years old up to 64, if I'm correct. Then why they just want the youth to take the COVID-19 vaccine, but they don't want elder to take it?
I think I was one of those people who were initially like very adamant about taking the vaccine, obviously for my own safety and those around me. I mean, I have older parents, grandparents, and I don't know who's in frail health and who isn't. But I think like literally yesterday or today there was an article in the papers about I think fake vaccines. So obviously now I'm a bit skeptical. I want to see how that will turn out, and then I'll decide if I actually really am going to go through with taking the vaccine or not.
No, I would not be taking the COVID vaccine because I'm not sure if the vaccine is actually safe. So I would not be taking it. I would like to see if after other people are taking it, how are they reacting? How is it reacting to them? It is safe, or are they safe or they are not? Then I can take it from there.
I believe the COVID-19 vaccine is safe. I've never seen any vaccine that's never safe that was developed. And if it comes, I'll take it, definitely.
Also, we're going to post a link to that video that is on the NMT page so that you can have a look at it. As I mentioned earlier, this is the 9th edition of the Ask the Experts show by the NMT. And it's a platform to give journalists an opportunity to ask experts in different fields questions concerning current affairs and getting to the bottom of things. And today we'll be focusing on this COVID-19 vaccine, discussing the myths versus the facts around the vaccine and also other issues as well. Our expert today is none other than Mr. Ben Nangombe, who is the Executive Director at the Ministry of Health and Social Services, or rather I should say experts, because he's joined by other experts who are part of the COVID-19 task force, and they will be answering all the questions today. So this is also on our Facebook page. If you have any questions, you can post it in the comments there, and we'll try and get to all the questions. I'm going to give it over to our journalists now. A few of them have joined this morning to see if they have any questions for Mr. Nangombe or for his team. But perhaps I can throw in the first question just to get the conversation rolling. The team has seen the video or heard the video. It seems like a lot of the people that were interviewed in that video were a bit skeptical about taking this vaccination, and also their reasons were quite peculiar. Let's talk about this misconception that these Namibians seem to have around the vaccine. And that question goes to Mr. Nangombe or to one of his team members that he's with today. Please, the floor is yours.
Thank you, Ms. Katanka, and thank you to all the journalists and members who have joined this conversation today. My name is Naomi Shopala, and I am the Director for Primary Healthcare Services in the Ministry of Health and Social Services. And I'm joined by my colleague, Dr. Theo Ben Kandetu, who is the lead for case management. So maybe we should start off by saying, when we listened to the video and the issues that are being raised, they are genuine just because you can see that people need information. They need correct information. They are referring to the information being inconsistent. And as we go in the discussion, we'll be touching on that. Because the information is coming from multiple sources. And to the public, not everyone try to see the credibility of the source of information. Hence, arranging a platform like this is critical to ensure that the information going to the public is credible. In one of the video, I think there is reference to, we don't know what is in the vaccine. It's our role at the Ministry of Health to explain how each of the vaccine was made, where it was made, how it works, and what are the composition of that vaccine to that extent. But maybe also to ensure the public that before this vaccine are administered, an information session is held. Information is given to each individual to explain why the vaccination, what is the vaccination, and literally to say, are you ready now to receive your vaccination? Because it's voluntary. An individual, after having received the information, it is their honors to accept or to say, no, I'm not ready for the vaccination now. But perhaps I can end there and give a chance to my colleagues, Dr. Kandetu, just to chime in.
Thank you very much, Ms. Shipala. We are joined now by our ED of Health and Social Services, Mr. Ben Nangombe.
Mr. Nangombe, good morning. My name is Nina Katangana. I'll be moderating the session this morning. Let me give you a brief background of what happened before you stepped in. So we actually did view the video of when the NMT team took to the streets to sort of gauge how the average Namibian feels about taking this vaccine and the vaccine in general. And a lot of the comments that we saw coming from the individuals that were interviewed was in the negative. They had misconceptions around the vaccine, saying they didn't know what was. They said that they would not be taking the vaccine for various reasons. So the majority of the interviewees were saying nay. And the question that I posed before you walked in was why Namibians have this misunderstanding of what the vaccine is. Ms. Ashipala then went on to explain that Namibians need to be educated on the vaccine, they need more information, and that will still be done by the ministry and its stakeholders. So perhaps you can take up from there.
Okay, thank you very much. So, Naomi, you had spoken to the issue then of the views expressed in those video inserts. Yeah, as I indicated, there are different contributions of speakers who commented on the vaccine. For example, that person, the first speaker, was that they will not take the vaccine because there's a lot of inconsistencies and not sufficient information for them to be able to take the vaccine up. I don't know how much Ms. Shopaladen had commented on that specific one. Do you want me to take that up, or have you covered that one?
Yes, please take it up, Edie.
Yeah, I think what we can say to that is basically that in general, vaccines are the most highly researched and tested medicinal products in the world, generally. And there's a wealth of data on COVID-19 vaccines, clinical trials that have illustrated that these vaccines that are on the market are safe and effective. Jessica, are you there? Are safe and effective to be used on the populations. And one of the benefits of these vaccines is that they will prevent people from developing severe COVID-19 disease should they be infected. And that will reduce the risk, or rather the degree to which people may need to be hospitalized and even dying from COVID-19. So that benefit has been demonstrated. Of course, we know that unfortunately many media platforms, particularly social media, have generated a lot of misinformation around COVID-19 vaccine and what is being now referred to as inconsistencies regarding the COVID-19 vaccine. This misinformation, and as we have known it to be the infodemic of fake news, has circulated widely on social media, but we have said as a ministry that Namibian people should try to get their information from authentic sources. The ministry, our development cooperation partners, and so forth, and perhaps from health professionals like doctors and specialists. So, and also, you see, I don't know why people would think that now the West would want to harm Namibia or Africa, for example. We have something called the extended program on immunization in this country. We have other medicines that we buy. We immunize hundreds of thousands of people against various diseases, such as polio, measles, rubella, and many others. We have done that for years. So our government, the government will not do anything to harm the population. And we are very careful in terms of what product we bring into the country. They would have been studied and that proven to be safe. So this whole thing of misinformation on the COVID-19 vaccine does not really make sense. I will venture to say, in my personal capacity, I'll venture to say, if, for example, the West wanted to harm us as Namibians, would they come out and now say, okay, we are going to do it through this vaccine? Would they not then just hide whatever they want to do and harm us in some other way, because we are buying many other products, medicinal products from them anyway? So this hype and this misinformation does not make sense. It distracts from what we need to do to protect the population so that we can return to some kind of normalcy. And we need our population vaccinated. The president of the country has indicated that when the vaccine comes, he would be among the first to want to be vaccinated. Of course, taking into account that you don't want to jump the queue, take up the product. If, for example, all of us in the ministry start to say, okay, we want to be vaccinated first, even if we are not frontline, we are then going to be taking up the vaccination that is required by those that really need it because of the nature of their work. But we want to discourage the population from engaging in spreading false information. And for those that don't have correct information. Let them be educated. We are open to educating the public and giving information that will help us have a better understanding of the vaccine. I think that's what I can say on the first video that we saw. The other one relates to Bill Gates having a hidden agenda. Bill Gates is a philanthropist. He has done many good things for the globe and for the world population. There may have been things that have been said about what is it? The motive of reducing world population and things like that. I think those things need to be contextualized. We believe that Namibia needs to protect our population. We have done so in the past with various vaccine products, and it's on that basis that we are proceeding. Again, we don't want to be the peddlers of false information and misinformation in this regard.
Thank you. I think on that note, let's give some of the journalists that have joined this morning an opportunity to ask you some questions. So journalists, if you do have any questions for the ED, please do go ahead. Well, in the meantime, while they get themselves ready, let me just ask the question in the interim concerning the education and information, correct information sharing around the vaccine so that Namibians feel more safe in taking it. Now, the vaccine plan is meant to be rolled out, from what I understand, towards mid-March, between mid-March and end of March. So when and how will these information sessions to educate Namibians on the vaccine be taking place, seeing that today is already the 10th of March?
Okay, thank you very much. I think the information on educating the public on the vaccine is information that has basically been ongoing. I have my colleagues here from the National Vaccine Task Force who can provide better details on the program that is envisaged to educate the public on these matters. The chairperson of the National COVID-19 Vaccine Task Force is my deputy here, Ms. Masabane. I can yield to her to speak to that specific question on the specifics and modalities of educating the public and producing materials that will be distributed to educate the public on the need for the vaccine uptake, the safety thereof, and the other aspects. Ms. Masabane, do you want to come in?
Thank you very much, and good morning, everybody. My name is Pitrunala Masabane, and like Edie said, I'm heading the National Vaccine Task Force. Just to explain that we have started a long time ago, exactly a year ago, to establish a risk communication and community engagement pillar under our national COVID-19 response. That pillar has been very active in disseminating information on COVID-19. Now that we have moved on to the vaccination plan, we have given that specific committee, which is a multi-sectoral, the task of also doing the education on the vaccination and specifically on the efficacy and safety of the various vaccines. Now they have come up with a communication strategy, which was developed with the participation of not only the Ministry of Health and Social Services, but also other ministries and private sector and specialists in the field. That communication strategy has been rolled out for, I think for now, for about 2 months already. What we have done so far is to have panel discussions, debates, etc., while we are also developing some IEC material. We also got some offers of assistance from the private sector to come in with their expertise in communication to help us to reach everybody. We have also trained our regional and district management and the frontline workers, not some key staff members, so that they can also be able to answer the questions of our people. And what we are going to do also, which is part of the plan, we are going to involve, of course, the media, journalists, very important partners in this respect, and political parties, traditional leaders, all those entities that really have the moral voice and a strong voice among their constituents. So there are various strategies that we will come up with. The reason why maybe it was not so visible up to now is we had to come up with our own internal plans, the deployment and vaccination plans. We had to agree on issues of the vaccine. We had to study. We have a clinical and scientific evaluation committee that is advising us, also a multi-sectoral committee, the experts within the ministry, but also outside. We have been looking at the information out there, not only from UN partners, but from international scientific platforms and committees and to advise us on the right approach. So you can't just go out and then say, okay, people, time to get the jab, if you don't have all the information on the jab, because that will do more harm than good. So we need to get our information straight. As you know, that this is a very fast evolving situation that we are dealing with. Every day new information comes up. You have to be quick in analyzing it and package the information in such a way that it is understandable to the people. So that many strategies, I think you will now, as things have become more and more clearer, I believe you will see much more engagement. And I also want to really thank the Namibia Media Trust for this opportunity, because I know journalists have been asking a platform where they can engage the ministry on a regular basis to have their questions answered. Thank you.
Yeah, maybe just to add to what Ms. Masabane has said, a week, now 2 weeks, when we held what is called the macro planning workshop or micro planning workshop, to really unpack our implementation and vaccination plan, which was lauded by the WHO as one of the best such plans. And one of the outcomes of that plan was to then develop health district plans. Namibia is divided into various health districts. And what we want to have is a district plan for each health district in terms of rolling out the vaccination, including still the issues on public awareness involving the stakeholders that Mrs. Masabane referred to, whether it is a spiritual institution, political institutions, traditional leaders, community leaders, our development cooperation partners, schools, and so forth and so forth. So it's on that basis that we are approaching this thing. We wanted to have the buy-in and ownership of people on the ground who are going to be responsible for this rollout of the vaccine, and also to basically re-energize the structures that have been in place already that have implemented our extended program on immunization, which has worked so well. Those that have been in the ministry longer than I have will tell you that in the past, when we have implemented our vaccination campaigns under the EPI program, we have reached coverages of up to 90% and more. And that is because of the public education that has been engaged in, involving the various stakeholders. And that is what we want to see happen, so that we really get our people protected. The priority populations and demographics have already been identified in terms of who's going to get vaccinated first, and the rationale for that has also been articulated. So it is a complex plan, but it's a doable plan, and we believe that with the involvement, particularly now of the media, to spread the correct information to the public is very, very critical. And we are counting on you to do just that. That's why we appreciate this platform to engage with members of the media so that we are on the same page with a specific reference to this important national effort. Yeah, I just wanted to compliment what Ms. Masabane had stated. I thank you. I yield that to you.
Thank you very much. I'd like to give the journalists an opportunity once again to come through with their questions, if they have any. I think one was directed to Dr. Theo Ben-Gurirab. Mr. Dwight Links from Eagle FM asked when the vaccine would be coming. Also, in addition to that question, we know that there are different types of vaccines. Can you just specify which one of those of these Namibia will be sourcing, and also what are the benefits and drawbacks, because surely there are drawbacks to this vaccine? Thank you.
Yeah, it's Dr. Theo Ben-Kandetu. Yeah, he's named after Theo Ben-Gurirab, so we forgive the journalist.
That's correct, my apologies.
Dr. Kandetu, please go on. Dr. Theo Ben-Gurirab Kandetu.
Yeah, no. I thank you for that, Edie. Ms. Katangana, thanks again for the question. Let me start off by addressing the second question, which is really which vaccines are Namibia looking at the moment. So as has been mentioned and communicated via various platforms by the Ministry of Health and Social Services, one of the main platforms that we will be procuring the initial doses of the COVID-19 vaccine is the COVAX facility, which in essence is a coalition between the WHO, the Gavi, which is the Global Alliance on Vaccines Initiative, as well as other partners. And it's really spearheaded by WHO to ensure that all its member states have equitable access to the COVID-19 vaccine. So that is really, in a nutshell, to say that member states would not be in a scenario where they do not benefit because the countries with bigger economies and bigger purchasing powers buy out the COVID-19 vaccines on the global market. And so this is really one of the platforms that we will be getting the initial doses. We are looking now at the AstraZeneca, which is one of the vaccines that we will be getting via this facility. I believe the initial doses are just over 100,000. One of the other platforms that we will be looking at in getting the COVID-19 vaccines in country is the African Medical Supplies Platform, which is under the auspices of the African Union. Some of the vaccines we will be procuring via this platform is the Johnson & Johnson, AstraZeneca, as well as others. In addition to that, we are also due to receive donations from some of our partners. One of the donations we are looking at is via via China. We will be receiving the sign-off farm via them. We will also be looking at the Sputnik 5 from Russia. So there are really, in a nutshell, a number of vaccines we are looking at procuring. And the reason why we are looking at a number of vaccines and not just one is because we wouldn't be able to achieve our set target of between 60 to 80% vaccination coverage in the population, just with one vaccine, just looking at the availability of the various vaccine products out there on the market, because there is quite a high demand. With regards to some of the other question that was mentioned, what are some of the is it the side effects or the differences in some of the vaccines?
The benefits and the drawbacks, yes, of the vaccine. Okay,
the benefits and the drawbacks. So of course, all the vaccines that will be coming into the country have been stringently looked at and have been evaluated by our regulatory authorities, both in country as well as by WHO and other stringent regulatory authorities. One of the things that they look at is the efficacy. So it is very, very important that at the end of the day, we get a vaccine that works, right? So we need to illustrate that there is an efficacious response in inducing immunity against COVID-19 infection and disease. So this is something that our experts continuously read upon, continuously evaluate as they are assessing the clinical data that come out of these vaccine trials. And that is really just to say, the recommendation according to WHO is that for a vaccine to be truly efficacious, we need to illustrate at least an efficacy of 50%. And so this is really one of the things that we look at to make sure that all these vaccines we get in country are effective. The other thing, of course, that we look at and that, of course, we have illustrated with all the vaccines that Namibia will be getting is the safety profile. And that, of course, is very important because at the end of the day, we need to make sure that whatever we are giving to the population will not do any harm to the population. And that, again, we have illustrated. These vaccines, as Edie has said, have gone through a lot of research, a lot of regulatory scrutiny to make sure that they are safe. So this, as I've said, we've illustrated with all the vaccines we will be getting in country. Now, having said that, of course, there are certain mild side effects or adverse events that are associated with some of these vaccine products. These adverse effects, as have been illustrated in the various clinical trials, are things like pain at the injection site. It could include things like myalgia or muscle pain, headaches, nausea, and fever. Now, although this may be uncomfortable for the ones who have been vaccinated and who experience it, these adverse events are not permanent. In fact, they are transient. So it has been illustrated in the vaccine trials that these adverse events do go away within a couple of days. And of course, it's a very important response also to elicit, because it does mean that your body is starting to launch an immune response against this, this enemy that we call COVID-19. So those are some of the benefits and the drawbacks of the vaccines that we will be getting in country. Thank you.
Thank you very much. The other question that I had is, from what we understand, Namibia went into an agreement or possible agreement with Botswana to obtain these vaccinations, to sort of have an advantage over, first world countries that are also trying to procure this vaccine. But we know now that our neighboring countries, Botswana, Zimbabwe, South Africa, have already received their vaccines. What happened to that agreement?
No, the agreement is definitely on. We are cooperating in the areas that we have agreed to cooperate, but that does not necessarily mean that each country cannot pursue any other means of either acquiring a vaccine or engaging in cooperation with other countries or other entities. So our cooperation with Botswana is ongoing. We have held meetings when the head of state of Botswana came here and thereafter. So that exchange of ideas and experiences and identifying areas of cooperation, for example, where we are saying that once the vaccines have been rolled out, we are going to see how, for example, to provide vaccination for our citizens along common borders, so that if you have an area along a common border where one or the other country has got service available there, we can then vaccinate people along those borders. Also, if citizens of Namibia are in Botswana in the hinterland, or the Botswana are in the hinterland of Namibia, they will also be able to benefit from vaccination here, provided that they fall within the categories of the prioritized population at any given point.
And may I just add that although we had this discussions with Botswana specifically, it applies to anybody who finds him or herself within the boundaries of Namibia. Yesterday, there was also a question of from journalists whether we are going to vaccinate diplomats, whether we are going to vaccinate migrants, and so on. When we roll out our vaccination, we will not really look at your legal status, your nationality, and what your status in Namibia is, but whether you fall within that specific cohort that we are vaccinating at the time.
Fantastic. We will get to that in just a minute in terms of who will benefit and at what stage. But I think perhaps the ED or one of his team members can talk us through the standard operating procedure once those vaccines do arrive in the country.
Thank you very much for that question. Very important, so that also the members of the public are aware. As indicated before, we are talking about rolling out the vaccine on the basis of the deployment and vaccination plan. This plan sets out in great detail. It's a plan of about 13 chapters, and it ranges from the identification of the target populations. It talks about the supply chain management, cold chain management, talks about human resources, talks about other logistics, talks about communication with the members of the public and so forth. But for that, I want to bring in our Director for Primary Health Care, under whose directorate the program on immunization falls, and also who has been involved intimately with the micro-planning workshop that was held, and also with the development of the plan itself. I think, Naomi, I've given the contours of what the modalities are and what, as Ms. Katalana pointed out, what the standard operating procedures are once the vaccine arrives here. Can you just drill down a little bit on those standard operating procedures that once the vaccine gets here, what then? Can you speak to that a little bit?
Thank you. So as Edie mentioned, the vaccine will be arriving in country through our central medical store department that receive all the medicinal products that are coming in the country. Now, as part of the plan, the central medical store has put up a distribution system to distribute these vaccines to the regional level. In the regions, we have multi-regional depot that receive the medicinal and vaccine product from the central level. This multi-regional depot will further distribute this vaccine to the specific region. In turn, the region will distribute the vaccine to the district level, and the district will distribute to the health facility level. It is from the health facility that specific health facility will then vaccinate the eligible beneficiaries. At the same time, as part of the micro-planning meeting that the district just concluded a week ago, they have identified or drilled down to the number of vaccination sites that each district would have, the number of vaccinators, the number of vehicles that each district will deploy to take the vaccine to the community level. But there will also be mobile team. We know that a policy has been made that government has to spearhead the vaccination. Hence, we anticipate, or we do not necessarily expect at this point in time that the private hospital will have the vaccines. Therefore, we will set up some of the private facility as mobile, where the team will go from a health facility to that specific private facility to immunize the health workers and any other beneficiary who could be reached through that point. We are intending to reach out to the place of work where the individual has been identified there. For example, the mining sector. In those region and district where they have a mine, they will have to set up a mobile team to reach that population and vaccinate them. This is in the interest of infection prevention and control. We are still in the pandemic state. We have to try and avoid crowding or having crowded places or having people traveling to specific vaccination point over a longer distance and having people mixing from here and there. That's why we are trying to have this mobile team to reach people who are concentrated in a specific place and vaccinate them right there. As part of this SOP and as part of our plan, this week we have expert trainers who are here in Windhoek. These are people from the universities, from the Namibian police, from the correctional service, from the Association of Private Hospitals, and from our international partners. They are gathered for 3 days to finalize the training curricula that will be used to train the vaccinator, to ensure that every vaccinator understands the basic of these vaccines, because it is the information that the community is yearning for that will ensure that everybody who is vaccinated understand exactly how does this vaccine work. What Dr. Kandetu alluded to as adverse event or so forth, this is what we are trying to address to ensure that before a person is vaccinated, they are informed after the injection, you will feel this and that and that. You will have pain at the side. You might have a mild headache. You might have muscle ache. So that when they experience it, they will not consider it that there is something wrong with them, but it's a normal process. So this is contained in the information that will be given during vaccination.
Thank you very much, Nani. That was the response. I yield back to you.
I just want to inform UED and team that we were supposed to have an hour-long session, but because we did start a bit late, I'd like to know if you're able to avail another 30 minutes to further this discussion.
We can avail 20. There is another meeting starting at 11:30.
All right, very well noted.
Okay.
Just to continue with the conversation then, Mrs. Sashipala spoke about the decentralization in terms of having mobile teams when it comes to this vaccination so that it reaches everybody. I want to go back to what she said earlier concerning the information and educating on this vaccine to every Namibian. Now, we know that people in the rural areas sometimes struggle to get onto platforms such as social media, struggle to get the newspaper to be informed and to be educated on the vaccine and its safety. How do you plan on reaching those individuals concerning that issue?
On that, I think, as I indicated, we will use the various platforms, including, for example, the radio stations. Both NBC as a public broadcaster and other broadcasting stations to do that. We are going to engage the community leaders, spiritual leaders, so that when these messages are spread, when people hold meetings, these community leaders are able to share this information. And again, of course, your traditional media of newspapers, of television, and now that we are talking about social media also can be a useful platform to spread this information. What I know is that we have already started to produce audio clips, video clips that are going to be used as part of this education campaign, and also at our own health facilities, so that when people go to receive services at the health facilities, this information can also be made available. So, but for, again, more details, Ms. Masabane and Ms. Her name is Shopala, not Shopala, Shopala. Okay, so let me yield to my colleagues to expand.
Yes, I think Edie has mentioned quite a number of the mediums through which we will work, but another very important part of our community engagement will be our community health workers. There are thousands of them already on board. We have also, in addition to those ones who are employed by the ministry, over about 2,500. They will also be trained to be able to deliver the basic messages and to refer people to the right person for more detailed information. But they will be equipped with the aids, the tools like pamphlets and brochures to distribute and to also to talk to people, because these are the people who are doing the house-to-house visits for health education, for some basic first aid interventions, and to take some basic commodities, health commodities to the people. So they will be trained so that they can also engage people on a household, individual, face-to-face basis. Then we are also getting additional support to get some more foot soldiers on the ground, people who can engage people on a one-to-one basis. Those will be short-term young people who will get on board to reach out to individuals and households. We also have, like the ED said, the training is ongoing. So the training of trainers will take place in a week's time or 2 weeks' time. And then they will go out and train everybody so that our health personnel is also able to spread the message. In addition, there are counselors in all the different constituencies. There are political parties. They will also be trained, provided with the necessary information to reach out to their constituencies.
That's fantastic. I'd like to know about the specific rollout plan. That's another question. Where will it start? Will it be all 14 regions at once? Who will benefit first? Are we looking at a specific age group first? For example, the elderly. Ms. Shupala did mention eligible beneficiaries. So who do we consider those to be? What does the rollout plan look like?
Thank you very much. Yes, I will yield to Ms. Shupala to provide those details, but what I can tell you is that we have in fact already a matrix developed identifying the specific prioritized demographics. The frontline health workers, the elderly, persons with existing comorbidities who are at risk of developing severe COVID-19 illness should they get infected, and so forth. So in other countries, for example, people have spoken about also including in the category of prioritized persons to be vaccinated school teachers, for example, or school children, because of the nature of the operations of schools in terms of bringing greater numbers of people together, and also what we have seen as infections in those congregated settings. But Ms. Shupala, we have the matrix setting out these categories. Do you want to speak to that briefly?
Thank you, Edie. Let me start off first saying we'll roll out the vaccination in phases. And we are doing so because we do not anticipate to receive all the number of doses or the quantity that we need to reach our target of 60 to 80%. So it's coming in batches. So within those categories that we prioritize, we will still sub-prioritize based on the number of doses that we receive. We know that with the latest communication that we received from the COVAX, we are expecting 108 doses of vaccine. With each
108,000.
108,000 doses of vaccine. Wow.
It's only enough for us.
Yes. So those 108,000 doses, with each individual receiving 2 doses, is just enough for about 50,000 people. And we have to calculate also potential wastage. But we know, as the ED have mentioned, we are also receiving some donation. So we are putting together all the quantity that we are very likely to receive by the time that we are beginning with the vaccination, and then sub-prioritize again. Among the health workers, we will look at those most at risk at the bedside. Yeah, because you might have a health worker who is working in the office. The one in the hospital by the bedside in contact with the patient is at high risk, one, of acquiring infection, and if they acquire it, of passing it to the patient if is not diagnosed in time. So those are the people that we are targeting. With those ones that are having core condition or comorbidity, we are even targeting, if the person is old and they have a condition like hypertension and diabetic, we will prioritize that person more than a person who has got a condition but is of a younger age. Because we have seen from our data in country who was more at risk of getting hospitalized, or who are those individuals that we have lost, either because of their age or co-condition. So that is the subgroup that we'll even target more. I also wanted to highlight that when we are rolling out the vaccine and prioritizing, we are looking at, as a country, how can we make the greatest impact with the vaccine? That's why we are prioritizing. That's why I think also the public need to understand that we are not only necessarily vaccinating to reach the target, the number that we want to reach, but we are immunizing to, one, interrupt the chain of transmission, and two, to make sure that those who are at risk of hospitalized, that risk is reduced. Those who are at risk of dying, that risk is reduced. So we know that we will have many people who are participating from the public, from the private, either contributing in one way or another. So, but as a population, if we understand that the prioritization is made to interrupt further transmission and the impact of the pandemic.
That's why we will also target people in confined settings, such as in correctional facilities. That's also one of the priority groups initially, to break the spread of the pandemic.
Thank you, Mrs. Masabane and Mrs. Shupala. Dr. Theo Benkandetu, then I would like to know, on the back of what the two ladies just said, how long then will it take us to reach herd immunity?
Thank you for that question. So that's actually quite a topical question right now, and it's one that many scientists are currently trying to answer. It is envisaged, just based on the available data and the ongoing clinical trials right now, that for a nation to reach herd immunity, even if you have dotted all your I's and crossed all your T's in terms of vaccination rollout plan nationwide, it would still take some time. And the time that we are talking about is roughly 12 to 18 months. So it will not happen overnight. It is something that will happen gradually over many months, as we are vaccinating more and more people, as we are allowing the desired immune response to set in. So it's not something that is going to happen overnight. What I would also like to add is that it is also envisaged that, or sorry, not envisaged, the clinical trials, the data that we have that come out of these clinical trials indicate that you would, once you are vaccinated, you would possess immunity for up to 8 months. Now, of course, there's a lot of nuances that go into the definition of immunity. So at this platform, I don't think I'm going to go into the specifics of humoral immunity versus the cellular immunity and so forth. But that is really what the science is saying, that the immunity lasts for up to 8 months. But because of the way that the immune response is brought about, the cellular immunity is thought to be much more, is thought to last much more than 8 months. But as I've said, you know, it is an evolving field right now. The research that goes into COVID-19 vaccines and immunogenicity that is derived from those vaccines. So a lot of the data is still evolving. There are a lot of clinical trials that are still ongoing. So hopefully in a couple of months, we will be in a better position to answer that question. Thank you.
Thank you so much. I think we can round off our discussion to allow the ED to get to his next meeting. So perhaps as we end off the session, we know that quite a bit has come out of state coffers, you know, in an effort to fight this pandemic. How much is this exercise further going to cost us?
The National COVID-19 Deployment and Vaccination Plan is a costed plan. The initial budget was about 583 million. And about 441 is for the acquisition of the vaccines. So that is what we have costed the plan for. But of course, as we are saying, because we are also using existing infrastructure and programs, for example, we don't need to necessarily put up new cold chain infrastructure because we are using what is already in place. We don't necessarily need to employ new personnel to conduct the vaccination because we already have nurses and others that have been participating in previous immunization campaigns. So we have this cost that we have determined for the plan, but additional resources will be covered from the existing funding that Treasury provides to the ministry.
And in addition to that, the cost of the doses of vaccine may also change over time because there may be other vaccines that become available on the market. And of course, you know, when you start with a new product, initially the cost is high, but the more it becomes available on the market, we anticipate that the cost per dose will also reduce.
And also just to add that we are engaging actively with the private sector. They have indicated there are good indications that they are going to make resources available. We don't know at this point how much we will be able to mobilize through that channel, but it is likely also to make a difference in terms of what is going to be spent on the rollout of the vaccination of COVID-19 in the country.
Well, Edie, Mr. Ben Nangombe, thank you so much for your time. Mrs. Masabane, Mrs. Shupala, and Dr. Kandetu, thank you so much for joining us on this session of Ask the Expert. From all of us here at the NMT, it's goodbye for now. Please do note that this session will be available on YouTube, the Namibia Media Trust's page. Also, it will be up on Facebook, so you can go back and have a look at it. But for this session, it's goodbye from myself, Nina Katangana, and the rest of the NMT team. Thank you so much.
Thank you, Katangana. We appreciate it for this platform. Have yourself a good afternoon.
Thank you.